Scientist from Oxford today has the pleasure of talking to Professor Willem Kuyken, who is the head of the Oxford Mindfulness Centre, situated in the grounds of the Warnford site in the University of Oxford. And I'm going to start by asking him the central question. What is mindfulness, Willem?
It's a great question, and it's one that's quite difficult to give succinctly, but if you allow me to give a fulsome answer.
Yes.
It's sometimes described as the awareness that arises out of paying attention in a particular way.
Right.
And that kind of particular way I want to kind of unpack a little bit. So it is about the way in which we kind of attend to things, that we train our attentional muscle so that we can actually, I can attend to you, I can attend to this conversation. But it has two bits to it which I think are really crucial. Mm-hmm. One is something around intentionality or ethics. The intention is actually deployed in the service of something wholesome, something good. And then the final part of it is that the landscape of attention is imbued with certain qualities. Qualities like kindliness, mm-hmm. curiosity, patience, and equanimity. So it's not a cold thing at all. It's not like can I just attend to you and inhibit things outside of my awareness? But it's a whole training in being able to cultivate an awareness that's ethical and that's imbued with equanimity, kindliness, patience, curiosity, these kinds of qualities.
Yes, so the curiosity could be then, what is this? Is
Absolutely.
That a kind of way of getting the curiosity side?
Sometimes people talk about beginner's mind, but it's with all of our experience, whether it's positive, whether it's negative, whether it's neutral, can we bring curiosity to that? So for example, take the state of boredom or agitation. These are two states that we very quickly can turn away from. What mindfulness says is, can we bring our attention to these states and be curious and interested about them?
So you can even ask the question, why am I bored?
Yes.
Yes.
Or more than that, what is boredom?
Right.
So it's not an intellectual question, why am I bored? What is boredom?
No. So this is not a question about philosophy.
It's an experiential question.
It's an experiential question.
So it's more of almost like a phenomenological kind of question.
Yes.
What is this experience of boredom? What is the learning? What is the teaching of this experience?
Now, you use this in a clinical situation, don't you? So you're using this to treat people who have very, very difficult problems, what we sometimes call mental illness. I'm not quite sure whether that's the right description, but people anyway who have great difficulty living with themselves and possibly also therefore with other people. Mm-hmm. And do you find that mindfulness, meditation of that kind, does that actually help?
So there's quite a lot of evidence to suggest now that it does work both with people living with long-term physical health problems but with mental health problems as well. I'll just start with the physical health problems because that's where this work started in the West, or mindfulness-based intervention started in the West. So in the 1980s, 1970s, somebody called John Kabat-Zinn started to ask whether mindfulness could be helpful to people who had long-term physical health problems like chronic pain. So somebody, for example, who has had a back break or has got real problems with their spine, which the doctors have essentially said,
can't do anything.
You're on your own. So there is this searing pain, this physical pain that somebody is living with. And what mindfulness says is, gosh, this is really intolerable suffering. But there is the primary suffering, and then there is what's sometimes called the second arrow of suffering.
You have to explain.
So the second arrow of suffering is if I am sitting with pain which feels like my leg is being ripped out of the joint here, the thought that very quickly comes on that is, this is intolerable. How will I live with this for the rest of my life? How will this affect my ability to bring up my children? All of these are sometimes called the second arrow of suffering. And what mindfulness enables people to do is to see that, to see the physical pain, to see the proliferative thinking that can actually exacerbate and worsen the suffering. And give people, in what I described earlier, that kind of sketch pad, if you like, of I don't want to suffer like this. I want to be there for my child. Can I bring, hard as it is, curiosity, patience, kindliness to this moment? And the idea is that that potentially can make the suffering easier to bear.
Yes, and can that be almost any kind of suffering? I mean, suppose somebody suffers from absolutely intolerable tinnitus.
Absolutely.
Can work for that?
Absolutely. Because the same thing applies. The tinnitus is whatever it is. It's the sound, it's the humming, it's the buzzing.
Yes.
People will inevitably put another layer on top of that. The mind will put another layer on top of that.
Which is saying, I can't stand this, I go mad.
It's saying whatever the mind puts on top of that, and every mind is slightly different. And mindfulness is essentially saying we can train the mind first to become aware, and then to work with that.
Yes.
So the area that we've been working in the most here in the Oxford Mindfulness Centre is around depression, and exactly the same thing applies with depression. So to give you again an example, there was a young woman who was in one of my classes who had suffered a lot from depression. She had a toddler, a child, and she described a moment where she was pushing him on the swing, and he was chortling with delight. He was really, really happy, and she was thinking, gosh, this is a happy moment. Now, she had suffered from depression in the past, and the kind of landscape, or the mental landscape of people who suffer from depression, is for negative thinking to be often not very far beneath the surface, and to have this ability to just kind of kick in, to roll in and really proliferate and take people into a downward spiral. So this young woman had this little thought of, this happiness won't last. I don't deserve this happiness.
Right,
And on the back of that rolls in, I'm not a very good mother. I'm going to mess up
and
my
there's
son.
the downward spiral.
And there, exactly.
Yes, of
now,
course.
can we, in those moments...
identify when it's going to start.
Exactly.
Yes.
Can people in those moments...
And then, this is a letting go bit, is it?
Letting go.
Yes.
Now, she actually developed a wonderful metaphor. Her metaphor was, these are my wrecking ball thoughts.
Right.
And it's such a wonderful metaphor, A, because a wrecking ball is such a powerful...
Of course.
But it's also something that will swing through awareness that we can step back from and watch it swing
Just watch it swing.
Watch it swing through awareness.
Right.
There's my wrecking ball thought. Here is this moment with my son.
And I'm a distance from that
and
now.
I'm decentered from that. I can, at some level, once I've got enough mental control, enough mindfulness training, I can choose whether I allow my mind to get caught up in that downward spiral, or I can step back, watch it, go through awareness, and then come back to playing with my son.
I think, please finish, Willem.
And one of the reasons I think that's such a powerful illustration is that depression tends to be intergenerational.
Yes, of course. You see apparent inheritance.
You see apparent inheritance, whether that's genetic or learned.
Indeed,
But for a mother to be able to see that happen and then to be there again with her son, at least provides more of a chance for her to teach him the resilience that will enable him not to inherit that depression.
Yes, which actually leads me to the question I was going to put to you, because some biologists, and I imagine some lay people, would also say, but wait a minute, all this is determined by my brain. I've got problems with my neurons, I've got problems with my brain. How can I possibly be curing those just by thinking? And now, the answer is you're not curing them, you're learning to live with them, aren't you? Have I got that right? Or
well, I think that's fascinating, and I think that's so interesting, and my sense is that the next 50 years is going to be the most extraordinary kind of integration of the physical and the mental in our understanding of models of the mind, but also treatments for mental health problems.
Right.
So you and I just enjoyed a cup of tea before we did this interview. Now that caffeine is a physical substance.
Of course.
It comes in through the mouth and the stomach and goes to the brain.
Exactly.
The attentional networks in the brain are stimulated by that caffeine.
Yes.
So what we're doing with mindfulness training is the reverse.
Right.
We're saying that actually with your own mental habits, you can train those attentional networks to focus more, to inhibit things we don't want to attend to more.
Right.
And actually some of the neuroscience research is in its infancy, and I wouldn't want to overclaim it, but it's beginning to suggest that mental training can lead to functional and possibly structural changes in the brain in the same way that physical training leads to physical changes in the body.
I see.
And again, I think that the next 50 years is going to be an absolutely fascinating journey of discovering that interplay between the mental and the physical.
Right. One final question for you, Willem. the alternative to this kind of treatment for people with very severe depression, for example, would be drugs.
Yes.
Do you compare? Can you compare?
Yes.
And what comes out of that?
What a great question. So we have just published a trial asking exactly that question. So it was a trial that was published in The Lancet just a couple of weeks ago, in which we asked the question, could mindfulness-based training, MBCT as we call it, be an alternative to people staying on medication long term?
Right.
So we took 424 people, and half of them were allocated to stay on their medication for 2 years as a way of staying well,
right.
and the other half came into the mindfulness classes, learned
Yes.
mindfulness, and
Right.
came off their medication. And whilst we did not see that the mindfulness was better than the medication, there was really good promising evidence within that trial that it could be an alternative.
Yes,
So for people
right.
who feel ready to come off their medication, who feel the mindfulness can provide that kind of support,
Yeah.
they seem to do as well as the
Yes.
folks on medications. I think the answer to your question is mindfulness can provide,
Right.
our follow-ups for 2 years, good long-term ways for people with depression to stay well as an alternative to medication.
Yes. And in principle, the mindfulness doesn't have the side effects that drugs often have.
Absolutely.
I think that's roughly right, isn't it?
Absolutely.
Yes.
It's a
Yes.
very participatory, experiential approach that we train people to use mental habits to better understand their minds and to change those mental habits. They are completely in control.
Yes.
As opposed to taking X dosage of a drug where the effects are whatever
Yes.
they are.
Yes.
With mindfulness training, we ourselves are actually trying different things and
Indeed.
seeing the effects.
Yes.
Trying different things and seeing the effects. It's quite hard work, and sometimes the effects
Yes.
are not quite what we want. We can sit with a lot of agitation, a lot of boredom, a lot of anxiety. But in that process, two things. One, we are driving it, and B, we're learning from it.
Now, how young can people be to benefit from this? Because you presumably can't teach mindfulness techniques to a baby, but sometimes these problems appear in people in their mid-teens, often.
Great.
So,
That's
can it be done in schools?
It's a great question, and the epidemiological data suggests that if people are going to have mental health problems in adulthood, some 50% of those will
Start young.
manifest
Yes.
in late adolescence,
Yes.
some 75% by early adulthood.
Right.
So can we get in before they manifest? Can we teach kids
Right.
resiliency skills before mental health problems
Right.
emerge? That's one really interesting question. Of course, mindfulness is a potential approach to doing that. The other thing is, where do we go to do that? The majority of kids spend the majority of their time in schools.
Of course,
Can we
so,
work
right,
in
yes, of
schools?
course.
Can we work in the context in which we
Yes,
find people
right.
and teach kids mindfulness skills? So we are just starting a 7-year program of work funded by the Wellcome Trust, in which we're asking precisely that. So some teachers working in the UK school system have developed a curriculum where they teach whole classes of kids mindfulness skills as a way of learning resilience, as a way of flourishing. The beauty of what they're doing, if you take what I just said about preventing mental health problems, if they're working with the whole class.
Right.
So they're not just taking the kids over here who are at quite high risk, they're taking the kids over here who are flourishing.
So everyone is in the same boat.
Everybody's in the same
Nobody
boat.
feels stigmatized.
Nobody feels stigmatized.
Yes.
But more than that,
Right.
the beauty of the mindfulness skills is they can, our minds are involved in all aspects of our performance.
Yes.
So the young person who is potentially headed for 5 A stars at A level may have a mind that's rather prone to self-criticism and anxiety.
Yeah. Sure.
They can use that.
Sure.
The person who is the head of the football club or the gymnastics club may find just before they're about to do their activity, their mind gets crippled by an inner voice. They can become aware of that. They can choose, as I said before, with the wrecking ball, to see that as a thought, not a fact. Come back to their body, come back to their task. So the beauty of what these guys, Chris Cullen and Richard Burnett, have done is to take this curriculum and really make it so it can be as applicable to the kids who are really struggling down here, to those who are flourishing here, and can be acceptable and liked to as many of them as possible.
Because you can't predict who might fall foul in the end of disaster.
Exactly right.
Sure.
The other thing that's come through the learning, and one of the things we'll be interrogating in our Wellcome funded work, is what's become really, really apparent is that if you're going to teach kids mindfulness as a way of becoming more resilient, you need to start with the teachers.
Right, yes. Because they have to have the attitude that says this is welcome, this is what we should be doing.
That's exactly right.
Yes.
So over the last couple of years, what they've discovered more and more, if school X wants to teach this to their kids, they say that's great. But what we want to do is we want to start with a group of your teachers. And we want to teach these same skills to your teachers as a way for them to embody the skills they're going to teach to the kids in front of the classroom. And what we're learning through that work, which is really interesting, of course, teaching is a stressful profession. There are lots of challenges in teaching. So for teachers themselves to learn these skills, it's a phenomenally, potentially powerful tool.
Well, you're doing a great job here in the University of Oxford, William, so thank you very much for talking to Voices from Oxford. Very, very interesting work. Good luck.
My pleasure. Thank you very much.
Okay.